Hello, my name's Elaine Halper. I'm one of the doctors that's on today. Can I just confirm your name and date of birth, please?
Lizzie Dicker, 16th of the 3rd, 1981.
81, good. Okay. And do you know why you're here today, Lizzie?
My husband thought I was a bit confused. I was just getting some stuff wrong, he said, and yeah.
Okay, that's fine. And have you been feeling well in yourself over the last few days?
No, a bit shivery and shaky, and yeah, just a bit run down. Just a bit horrible. And yeah, I think I had a fever last night, but just
all right. Okay, and any pains anywhere?
no. I mean, my tummy's a little bit sore, and when I'm going to the toilet, that's really sore.
That's really sore. Okay. So I'm just going to start by doing a reassessment of you, if that's all right. So I'm just going to start with A, the airway. So Lizzie's talking to us in nice sentences, so we can say the airway is patent and move on to B. All right, so B is breathing. So here we want to assess the respiratory rate, so we can have a wee look and see how that's doing. I'll just attach a wee monitor to check the oxygen saturations, and then we can have a wee feel. So can you pop your wee tongue? I'm just going to check that the trachea is nice and central, which it is. Good. And I'm just going to look for equal chest expansion. Okay. And I'm just going to ask you to do a nice big deep breath in and out. Good. And again. Excellent. That's great. So I'll just have a wee listen into your chest. So nice big deep breath in and out. Good. Good. Excellent. So no crackles or wheeze heard there, so that's great. Thank you. Sit back. Any recent coughs or colds?
No.
Good. Okay. So at this point I'd want to have a look at the oxygen saturations. So they're coming up as 94%. Do you have any lung password the question at all? Any asthma or safety? No. So I probably want to pop you on a wee bit of oxygen if that's okay. So we could connect her up to a nasal cannula, and we would just pop a couple of litres on there and see how our oxygen saturations come up with that. Moving on to C then, so for circulation. So I want to have a wee feel of your pulse. So I'm just going to have a feel of your pulse here. Okay, and I'll just take a wee reading. Okay, so the pulse is quite fast, strong in character. So it's about over 110 beats per minute, okay. I'm going to have a wee feel of, just going to check the capillary refill time. So that's a wee bit slower at 4, which implies you're maybe a wee bit dehydrated, and the palms certainly feel a wee bit sweaty and clammy. Okay, so what I'd like to then do is get a wee blood pressure reading at this point. Okay, and then I'll have a listen into your heart sounds. Good. So there was no added sounds there. Heart sounds 1 and 2 were pure. So you could also ask the nurse at this point to get an ECG reading as well. And then I would offer to do access. So I put a large bore cannula into the antecubital fossa, and I'm going to take off full blood count using these LFTs and a CRP initially. And at this point it would be good to take some blood cultures and a venous blood gas as well to check the lactate. Okay, so moving on to D then. So I would ask the nurse to check the glucose. I would then offer her to look in the pupils. So I'm just going to shine a wee bright little light in your eyes. Okay, good. So the pupils are equal and reactive to light. Do you have any trouble looking at the bright lights or anything like that?
No, not really.
Good. And any neck stiffness or anything like that? No, excellent, good. So on the AFPU scale, maybe a wee bit confused, she might be scoring, so that she'd score 3 for that on her news chart. Okay, so if I just get everything together again and think about reassessing at this point. So the airway was talking in the sense it was patent. B was a wee bit lower, oxygen saturations have come up with the oxygen, so that's great. C then, blood pressure. So the blood pressure, if you were checking when I put on the cuff, is back now, so it's a wee bit low. So it's at 90/63. So at this point you'd offer to give, now that you've got your access, a normal saline stat bag of fluids and see how the blood pressure responds to that. So we'll just do that now as well. Okay, then, and we've done D, your glucose is back at 5.8, so that's alright. And we'll move on to E. So E is everything else. So I'll just start by having a wee feel of your tummy. Ideally I'd have you lying flat, but we'll keep you as comfortable right now.
Okay.
Any pain anywhere before I start? No.
No.
I'm just going to have a good wee press. Good. Good. Excellent. Now I would have a good look at the legs and the arms and looking for any erythema, any signs of cellulitis or any rashes, particularly non-purpuric rashes. So I'm just going to ask you to sit up at this point as well, and I'm going to have a good feel down the spine, feeling for any evidence of discitis. If you just let me know of any pain at any time. Good, that's fine, thank you. So I could offer to have a look in the ears to see if the membranes were particularly red or not. Then I would ideally like to get a urine dip and a chest x-ray to complete the full investigations. At this point you're probably going to be shown a news chart. Okay, so with everything that we first found, the respiratory rate was 22, oxygen saturations in 94%, blood pressure 93/60, heart rate of 115, and scoring 3 for confusion and a temperature of 39. That puts her at a news of 11, and the clinical picture seems like this patient could be septic. Okay, so now that we've done our full A to E, we would want to apply the Sepsis 6 bundle, ideally within the first hour of assessment. So Sepsis 6 bundle would be the oxygen, which we've done. So that's one thing that you can give. You could give IV broad spectrum antibiotics. In this case, we would ideally choose the ones for urosepsis, I think is the most likely source. We could then give IV fluids, which are already started. That's great. We would then want to take a lactate, which you could do on those initial bloods. You'd want to take your blood cultures on the initial bloods, and we'd want to measure the urine output and ideally put in a catheter to someone if they're really quite unwell. Okay, at AT assessment, again, once you finish, you'd ideally offer to redo it all again, as it's all about assessing once you've completed each.